To use SurgeonNet Anesthesia Management, you must first log on to the system. When you enter your logon information, you tell the system who you are and what privileges you have. Once you are logged in, you can search for and select the case for your patient using various search criteria, such as name, location, or date. After the case is located, it can be opened and your documentation can begin. To launch anesthesia, choose from your toolbar SA Anesthesia. Anesthesia is now open. The default open screen when you log in is case selection. There are multiple ways to search for your patient's case using this tool. The recommended use of these filters is to select your current surgical location and to use the default that is already set for today's date. Next, choose Search. In the bottom half of the screen, the cases will appear based on the filters you have set. These columns are defaulted based upon the OR schedule. The two important columns to note on this screen are the first two with checkboxes. The first box is called Checked In. In most cases, the box will have a check mark already checked, indicating that nursing has checked in the patient into the SurgeonNet system. This is only important to the anesthesia provider because if the box is not checked, the case cannot be finalized. The second box indicates if the case has already had an anesthesia record created or not. If there is no check mark, the case has never been accessed, or no record has been created in anesthesia. This will be a typical scenario for accessing a patient in anesthesia. If the case has a check mark, then you or another provider has already opened and initiated the anesthesia documentation on that patient. You are now ready to begin the process to start an anesthesia document intraoperatively as you set up your room and prepare to get your patient from pre-op. After finding the correct patient in your list, you can either highlight the case and choose OK, or you can double-click on the Record Created box to open and create the record. Before you begin documenting, the application will prompt you to do some initial setup for the case. First, clarify that the patient name and identity is correct. The next step you encounter is associating monitors to a case. This step allows the anesthesia provider to select hemodynamic monitors, anesthesia machines, and gas detectors that are in the room where the procedure will be performed. By associating monitors to the case, the information on these machines will populate to the record without entry by the provider when data begins to be collected. Note that monitors are divided by surgical areas in the tabs at the top. In this example, we will use a hemodynamic monitor named SFORA-03 and an anesthesia machine named SFORA-GS3. As you select the monitors, they populate to the list on the right side of the box. Proceed by choosing OK. After associating monitors to the patient, you will be prompted with another setup. The system has realized that you have accessed the record and will give you the option to start documenting your provider time. In most scenarios, it is appropriate to start your provider time upon initiating the anesthesia record. You have now successfully selected and initiated a case in the anesthesia application. The final step prior to beginning documentation is to set up a macro. To learn more about macros, proceed to the next video.